Hi, everybody. Thanks so much for coming to the VetMedology live webinar for the Phone Triage Masterclass with Dr. Shadi Ireifej of VetTriage tonight. Myself and Brian are here to go ahead and introduce Shadi to you all. Let me go ahead and pull up his background real quick. Dr. Shadi Ireifej was a Cornell University DVM in 2006, an Angel Memorial intern in 2007, an LIVS surgery intern in 2008, 2009, an LIVS surgery resident in 2012, an LIVS staff surgeon in 2015, and an LVVSC staff surgeon in 2016. He became a locum surgeon in 2017 and then worked at United Veterinary Specialty and ER in 2018 and True Care for Pets in 2019. And now he is the owner, co-founder, and a chief medical officer of VetTriage. So we're going to go ahead and let Shadi take it away, okay?
Thank you.
You're welcome.
Okay, does that work? And then can you see it?
Yep.
Okay, perfect. Make sure the clicker works. Great. Yeah, thank you everybody so much for attending, listening, watching. It's an honor to be here, and hopefully we can gain a lot of valuable information from this. As you guys already heard, here's my background. For those who don't know me, here's our outline for today. We're going to start with the beginnings of vet triage, followed by some basic definitions revolving around telehealth. We'll talk about some basic principles regarding telehealth platforms, just so everybody here knows what's out there, what the different options are. We'll talk about vet triage a bit more in terms of where we stand in the field, as well as publications, where it fits in the pillars of veterinary medicine. But then, most importantly, the stuff that you really want to get into here, I'll show you an example telehealth session from vet triage. And then the majority of this conversation will be overt emergencies that you at the front desk, receptionists, CSRs, technicians sometimes, but those who are receiving phone calls, we're going to go into a lot of detail with different animal types, different conditions of the more common overt emergencies you see. This will be focused on dogs and cats. Then we'll talk about some other species that we typically see, especially on vet triage. Finally, we'll talk about how all of this information combined with your expertise and your experience with how the hospital that you're currently in is run, what the best way to kind of optimize the workflow so that you feel like you're helping people who are calling, but not overstepping any boundaries. And then any questions, comments, or ideas are, of course, welcome. This is an example here, this picture of the VetTriage website currently where people log in. So just to get started with how a surgeon got into telehealth, while I was at Long Island Veterinary Specialists, I had realized that the receptionists there were taking 100 phone calls every 24 hours. It was a 24/7 ER multi-specialty facility in Long Island, very busy part of New York. And the answer when people called in about whether or not they should be seen was always the same. If you are concerned, come in. And this is not unique to Long Island Veterinary Specialists. This is every hospital. This, regardless of your size, whether you're a small mom and pop practice with only a few staff, all the way to a large 200-person facility like Lives, the answer is always the same. And when you combine that with the struggles that we face, what I'm terming here is cultural toxicity, but the work-life imbalance, the mental stress, all that stuff that we are now unfortunately all too familiar with, that was the recipe for disaster. And that was before the pandemic. Once the pandemic hit, things went out of control because now you had the combination of short staff, a lot of pet adoptions, more people can't get access to care. And then you had the whole car side service as well, which slowed things down. Everybody was trying to accommodate, and it was just a nightmare for a lot of places. You were looking at up to 72-hour wait times for emergency care. Most areas, at least 8 to 10 hour plus. So combined with the stuff that I was looking at back in 2007 as a resident, or rather as an intern actually at Lives, followed by the pandemic, I had been working on vet triage for almost 15 years now to help progress telehealth. So when you look at the AVMA, the American Veterinary Medical Association, this is on their website, they will show this graph, and the green arrow there is focusing on where VetTriage lives, because teletriage, teleadvice are the two areas of telehealth that the AVMA is actually okay with. It doesn't require a veterinary client-patient relationship, which takes out the messiness of that relationship, like you see with telemedicine, which is telehealth in a brick and mortar facility. We are outside of brick and mortar, and therefore not looking to establish a VCPR. And so that's where we live. Now, there's other teles, as you can see here, teleconsulting, telediagnostics, teleprescriptions, telesupervision, but we're focusing here on teletriage, teleadvice, because that's where the vast majority of legal bodies will approve this being utilized. So the definition of telehealth is an overarching term that accompanies everything tele. It's a healthcare service, public health service. It involves telecommunication technologies to help with patients, and the client patient are located at a different site than the provider. That's the basics of telehealth. Underneath the category of telehealth, you have all those definitions that we just mentioned. We're going to focus on teletriage, teleadvice. That's what all of you are interested in. Teletriage being defined as the timely assessment and management to assess urgency, whether you should refer to a vet or not. Teleadvice is giving information regarding that pet. And the reason why I bring these two categories up together is not just because they're the two that are accepted by virtually everybody across the globe, but it's hard to have one without the other. You can't really tell a pet owner, no, it's not an emergency, have a good day. Their next question is, well, what do you think it could be? What should I look out for? What should I do? So teleadvice and teletriage kind of go hand in hand. This picture here is an example of a flyer that we'll create for our partners to access VetTriage. It's got a small blurb up there. The landing page, you can see Cornell University utilizes us, and then a QR code, and they can hand this out to clients at checkout or in the lobby. When you look at different types of telehealth platforms out there, there's a whole bunch of factors to consider. And again, this is not to pitch VetTriage, nor is it to make everybody here a televeterinarian. It is to make you aware of all the varieties that exist. So starting at the top left, you can have a software that allows you to provide telehealth. You can have a platform in hospital or outside of hospital that's non-video or video. Those are two different things. You can have a telehealth platform within brick and mortar, or you can have it outside of brick and mortar. Third parties also exist, which is where VetTriage lives. Asynchronous versus synchronous. Asynchronous meaning there's a delay between the communication back and forth from doctor and client. Like text messaging, for example, or emailing. Synchronous is real time. So you're on video with them live, back and forth. You're on an actual phone call with them, back and forth. Synchronous, there's no delays. And those two factors matter. Are you going to have veterinarians, LVTs, or for this talk, are we talking about receptionists? Are you going to house specialists and GPs? What kind of telehealth type are you going to be running? Are we doing teleadvice, teletriage, telemedicine, teleconsulting, telediagnostics? What species are you going to tackle? And then, of course, who's your target audience? Are you a business that's directing your services to the consumer, which is the pet owner? Are you talking business to business? VetTriage is the third category. We work with hospitals to help them offload cases to us when they're feeling overburdened, overwhelmed, understaffed, at capacity. There's a bad snowstorm outside, whatever it is, and then from there, the consumer comes to us. That way, we're the friends. We are friends of the vet field. And then what hours of operation? You don't have to be 24/7. We are. It's much easier to be 9 to 5 Monday through Friday, right? So it just depends on what kind of operation you're looking to run. The picture there is an example of Cornell's website again. That's our VetTriage logo. It is an outdated logo. They have not updated it yet. But basically, if a client calls a front desk and the front desk says, look, I don't know if that's concerning enough for you to come in, but I can tell you we have a 3-hour wait time currently. Go to our website, click on VetTriage, and you'll talk to a doctor live on video, and they'll triage you, and then they'll access us, Cornell, as a referral if we can take your case or not. VetTriage is actually approaching 150,000 sessions now. We've been in function for about 4.5 years, almost 5 now. We've been accessed by people from over 20 different countries, triaged almost 40 different animal types. We have 70 plus vets on staff, half a dozen support staff, most of which are LVTs, but some are receptionists who have experience in the vet field. We are 24/7 with, actually, we're approaching 1,000 partners now. We launched a Spanish-speaking platform in 2022, an equine-only platform in 2023, and we've got publications in the works. This is our first publication. We have more to come. We published in Frontiers in Veterinary Science. They have an excellent spread, so we can hopefully get lots of eyeballs on this. This was December 2023 that we finally published this. 15 animal types that were aided by the use of VetTriage. And here are all the different animals that we saw. That's the publication there if anybody's interested in reading about it. But the idea here was to publish one case example of every single one of these animals who have never been reported before in the literature to have been taken care of by telehealth. And you can see some pretty unique animals in there: the plecofish, a squirrel, a sea otter, pretty neat stuff. And this is all just a clip from the videos that we had from those exact cases. Here they are, all the animals we took care of for that paper. And so if those who are interested can go ahead and look at that. More papers to come at a larger scale as well. Now before we get into the meat of this with overt emergencies, I want to show you an example video of a typical teletriage, teleadvice, assuming it plays, of course. We'll see. Let me know if this can't be heard. It's about 8 minutes long. It shouldn't take too long.
Hello there.
Hi.
Hi. I'm Dr. Ireifej. Nice to meet you.
Nice to meet you. I'm Erin.
Hey, Erin. What do you have going on?
So I'm fostering. Well, they were two pregnant. One had her kittens on Friday. The other one.
There you go. Yep.
The other one. So she was fine, and then one of my main cats got under the door and stressed her out a little bit. And then, like right after that little tiff she had with the other mom cat, she started like acting a little bit more weird, trying to go up to the mom cat, and then she was like kept.
Oops. Uh-oh. Let's see. I don't know what happened there. Should I stop sharing and then reshare?
Yeah.
My apologies. I don't know what that was.
Okay.
So, Okay. Okay. Sorry, guys.
Hello there.
Hi.
Hi. I'm Dr. Ireifej. Nice to meet you.
Nice to meet you. I'm Erin.
Hey, Erin. What do you have going on?
So I'm fostering. Well, they were two pregnant. One had her kittens on Friday. The other one.
There you go. Yep.
The other one. So she was fine, and then one of my main cats got under the door and stressed her out a little bit. And then, like right after that little tiff she had with the other mom cat, she started like acting a little bit more weird, trying to go up to the mom cat. And then she was like kept trying to go back to her, and she wants more attention now. She's purring pretty rapidly more. Very minimal discharge, so I don't know if she actually is going into labor, but she keeps trying to lay in the bed with the other cat and the kittens. So did maybe the stress just cause something, or is she in labor? Do I have anything to worry about?
Gotcha. Okay. All right, cool. How old is this one?
Honestly, I have no idea. We got them from, this is going to be this cat's third litter.
Okay,
So,
that was my next question. How many litters this one had? Okay, so this is the third litter. Very good. And do you know approximately when she, I guess, how long she's been pregnant for?
Probably around the same time. So, like, I really don't know. I got them when they were already pretty pregnant. So I've only had them for about 3 weeks now.
Okay.
She's not as poofed out as the other one was right before she gave birth. So maybe she's just a smaller litter, and her nipples are still.
Yeah.
There you go. Like,
And then how many babies are in there? Is anyone taking x-rays?
No, this has completely been home stuff.
Gotcha.
I feel maybe like 3, but sometimes it's hard to tell.
For sure. Let me look at her. Let me see. If you were to pick her up and then like put her on the bed, can you do that and then watch what she does?
Yeah.
Okay. I want to see.
Ooh. I know.
No, boo boo. Let's see what she's doing here. Is she on any medications or supplements?
No, she's not on anything. She's on kitten food and then wet food once in the morning, once at night. So she went back to her bed, but earlier she just kept trying to go back to this cat and her kittens right there.
Gotcha.
So now she seems to be going back to here. So now I'm thinking she's in labor, but she really doesn't have a lot of discharge.
Yeah.
She has some, but not a whole lot.
No, here's the thing. I agree with you. I mean, the nesting, the neediness. I think that's all. I think she is, if not in labor, going to be in labor tonight.
Okay.
This is fairly. So what I would actually think of doing, if you're okay with it, is just minimize stress in the room. Maybe dim the lights. Kind of give her own space. Let her do her thing. Watch her from a distance and see what she does. Have food and water available for her and see what she does.
Okay, and then I guess my next question is, so originally me and my sister were gonna like each take one of the cats. So if she does take this one, it would obviously have to be after she's had the kids, right? Because we don't want to stress her before she has them.
I think so. I think it's a smart idea. Whatever we can do to minimize stress in this cat's life, because
she's having contractions.
Yeah, there you go. Yeah, let her do her thing.
Okay, so then after she has the kittens, what's like a good time frame that she could be moved with them? I just don't want any stress for the other mom, and I don't want continued stress for her. They're okay for the most part, but
the easy answer is no one knows that, right? But I will tell you that as a board certified surgeon, having done plenty of C-sections, dogs and cats, I will say that the second the surgery is done, the mom's awake, the kittens are awake, the kittens are nursing, mom is good, I send them the hell home. Like, they go. So, and it's literally hours after surgery, hours after giving birth with a C-section. So I would say the second the kittens are out and they're nursing, mom is good, move them whenever you want.
Okay. All right.
Yeah.
Well, then I think that's it. I mean, she might just have a slower labor than the other one did, but.
Let's do this because it's still early in the night. I'm going to email you, and I'm just going to send you a blank email. I'm going to send you a blank email. That way, if you have any updates for me, if you want to send me pictures or videos and say, hey, doc, it's been 3 hours. Here's what's going on so far. What do you think? Or whatever. Or you may not need me, but let me at least send you a blank email, and that way you can at least have access to me beyond this video session, so we can make sure things are good with mom here.
Okay. All right. I appreciate that.
My pleasure, of course. But yeah, I think you're on the right track. I would say dim the lights, let her chill. And and I don't know if having the other mom and the kittens in the room is more stressful or more relaxing. It's kind of your judgment call.
Yeah, I mean, the only other option would be to have her give birth in my room away from the other cats that are in my house and then her, but then I'm not sure if that new environment would also make it just more stressful for her because there's a bunch of new smells. The other cats' smells are predominant there because they sleep with me.
Then, yeah, whatever is least new, I would say, is the way.
Okay, so just keep her in here and keep an eye on her.
Yep, that's fine. Just dim the lights a little bit and keep things kind of chill.
Okay, all right. Well, I appreciate your help.
Of course, my pleasure. I will send you a blank email here, and we'll get you, and just keep me updated if you want to. Yeah.
Okay, great. Thank you so much. You have a good night.
You too. Bye-bye.
Bye-bye.
And so then a couple hours later, we get an email with picture, mom and kittens. Everybody's fine. And so it's a great example of a teletriage, tele-advice session that happens all the time on VetTriage. Obviously, I'm showing you here kind of what I would consider the gold standard level of virtual care, where you have a doctor on video, it's synchronous. Great. But if we're talking phone triaging, you don't have all that luxury. And so what's the best you can do? These charts, I'm sure many of you have seen before, is an attempt at facilities to try and get the pet owner to decide what's considered urgent, non-urgent, emergency, etc. And if you look at them, these are okay. I'm not the biggest fan of these things, but if it helps the hospital out, that's fine. My issue with charts like this is there's always going to be more to the story. You know, a level 2 trauma, as you can see there in the orange, trauma can be anything from I accidentally stepped on my dog's paw, or the tail got caught in the door, all the way to hit by cars and gunshot wounds. And so, you know, where do you gauge that? If you look at level 3 there, urgent, not eating, you know, most of us, we're not really going to have a big problem as far as urgency. If there's an adult dog that missed a meal or two, we can kind of figure that out more. But if you have a cat that's overweight, who hasn't eaten for like a day and a half, 2 days, you worry about hepatic lipidosis. Well, that's an emergency. So these charts are cute from that perspective, but they're really not the end all be all. However, for those of you who are listening and watching this, if you want to use a chart like this, if you're not medically trained, but you want to have some sort of guidance over the phone, these aren't that bad if you want. They're better than having nothing. So when you look at overt emergencies in general, this is true in people as well, especially during wartime, you're worried about saving life, sight, and limb. Those are your 3 big ones. And I changed sight to ocular to make it LOL for those of us who are, you know, into the millennial generation and Gen Z. It's maybe a bit easier to remember, but life, ocular, limb, those are your main concerns. And as far as overt emergencies, these are things that are supposed to be like, you hear it over the phone and you think, oh boy, you know, this really does sound like a concern. And when you break down, this is very broad, guys. We're not going to go over every single disease. But when you look at overt emergencies involving the risk of losing life, trauma is always a common one. Hit by cars, gunshot, fights, jumping out of buildings. And the other 2 categories, again, broadly speaking, disease or pathology, and then environmental issues that you worry about. So we'll talk about trauma now as a category of an overt emergency that risks losing life. So, for example, the boxer with the muzzle up there, gunshot wound. Typically, those are going to be considered emergencies. Not always. It depends. Certainly, a gunshot wound to the chest is going to be one where you want them to get seen right away. The bottom picture with the cute golden doodle in a car, just got hit by a car, super happy, jumping up and down, bouncing, wondering why mom is so stressed out and driving like a maniac to the ER. It's scary to see your dog get hit by a car, but we all know in the field, not every hit by a car is an overt emergency. And so if the dog got hit by a car, although there are things to discuss, you don't necessarily need to send every single hit by a car to the emergency room. You prefer to maybe dive in a bit more as to what happened during the time of the incident, if it was witnessed. How's the dog doing now? Give me some parameters for the gum color, the breathing pattern, the abdominal distension, things like that. But not every hit by car needs to be seen on emergency. That this really cute German Shepherd with the e-collar, the 2 bandages, those are his x-rays there. Bilateral radius ulnar fracture, probably jumped out of a window or off a deck. So high-rise syndrome, where they end up fracturing both thoracic limbs because they're trying to brace their fall from jumping a high distance, very common. And is it life-threatening? Probably not. However, pain management, very important. And so that would constitute an emergency on its own. But of course, you can have internal trauma when you jump out of a window or off a deck. So those things need to be assessed. And then finally, the drawing is a bite wound. Not every bite wound is an emergency. Most aren't. We find on VetTriage over 80% of cases in general are not actual emergencies. So a bite wound like that, it depends. Depends on location, active hemorrhage, what caused the bite wound. Are we talking about like a possible rabies suspect, or are we talking about the neighbor's dog? And these things all have to be fleshed out. So not every wound is an overt emergency. So if you have someone who calls over the phone with trauma, these are factors that you want to consider. You certainly don't want to ignore stuff that people say, but also folks are going to be a bit stressed out if they find that the dog was hit by a car, and they're not going to be the most logical, and rightfully so. It's quite scary. So that's an overview of trauma. Do the best you can to figure out what the story is, how the patient is now, and figure out how much of the owner is stressing out because of emotions, or is there really concern here? When you look at disease and pathology, we're not going to go over every single disease. Obviously, it's a lot to cover, but I want to go over some basic ones that can be a bit tricky. And potentially over the phone with some simple questions, you might be able to figure out at least a way to give this pet owner some direction. And of course, I have here a Cavalier King Charles Spaniel because they're the poster child for every disease known, even though they're really cute and nice personalities. So various conditions. The first one we're going to talk about here are respiratory issues. The radiograph on the left, it's a lateral plane radiograph of the thorax with some abdomen in there. It has a little R symbol at the bottom. That one is your classic bronchopneumonia. That's a pneumonia case. If you look at the lung field, the cranioventral distribution, there's consolidation at lung lobe. That's typical pneumonia. And of course, dogs can have fever, nasal discharge, a moist cough, difficulty breathing. The other radiograph on the right has a large heart with the same sort of consolidation, but at the caudal-dorsal portion of the lung field. That's indicative of congestive heart failure. And those two lung patterns are very distinct. Usually, there can be some overlap in how they look, but essentially, you have a dog, same thing with the one on the right with the heart failure, nasal discharge, breathing heavy, abdominal effort, lethargy. It's going to be very similar at home in both situations. But if you're triaging, I mean, forget even on video, over the phone, you're not going to have access to radiographs, obviously, not to mention somebody has to interpret them. So how do you figure this out? So the essential question is the breathing pattern that the pet owner is seeing at home scary enough to warrant an immediate visit, or can it be band-aided until they can be seen? And a lot of differentiation at home with pet owners between something like pneumonia, which is lung disease, or congestive heart failure, which is cardiac disease, plus a lung component to it. A lot of that times you can base it on the history. A lot of pets that have heart disease, having a flare-up of heart disease, have a history of it. They're already on medication. They've been diagnosed with mitral valve, tricuspid valve regurgitation, or DCM, or what have you. And suddenly the patient now is decompensating. That gives you a hint that although there may be something else unrelated to the heart causing this dog's breathing problems, but if they have a history of heart disease, it's very suspicious. You might be more inclined to push that person to see emergency if they have a history of heart disease. Similarly, with the pneumonia case, if there's a dog that has a history of a disease that predisposes them to recurrent pneumonia, like megaesophagus, for example, or they're brachycephalic that keeps having vomiting episodes, well, now you're more thinking, boy, this might be a pneumonia case. Maybe I shouldn't have them sit on this. Maybe they should go. Versus any other reasons for like difficulty breathing, let's say kennel cough, for example, which typically is not a medical emergency. You could have pets that have issues with thunderstorms that are breathing really heavy, and the pet owner will describe it as a breathing issue. Yet when you quiz them, they say, oh yeah, it's been thundering and lightning all night long, and my dog hates that. I didn't even think about it. I didn't put two to two together, right? The cat is panting, open mouth breathing, panting at home. Well, are there guests over? Is this cat stressed out? And is it simply a stress response? Or are we talking about heart failure, asthma, bronchitis, etc., right? Two very different things. Even in the scenario of open mouth breathing, you still have to dive in a little bit more into the details as far as, well, is that truly open mouth breathing, or are we talking about a panting dog who's just panting more than normal? Because people will describe things like that. So a bit complex, folks, but just to give you food for thought as far as trying to differentiate between these things. Here's another very common issue, urinary emergencies. So most of you probably can guess that orange cat there who's licking his private area. And he's having trouble urinating. The owners haven't seen him pee for maybe 24 hours, if not more. He's constantly licking back there. He's pulsating back there. He's vocalizing. He goes to litter box, in and out. Nothing comes out. He's 3-4 years old. He's a male. You're thinking he's a urinary obstruction. He's a blocked cat. Versus the black cat there, 18 years old, has a history of heart disease and hyperthyroid, some renal insufficiency, is also visiting the litter box, in and out of the litter box, has some blood in the urine, little droplets. Well, the chances of an 18-year-old cat being afflicted with a urinary obstruction, a disease that's most commonly seen not just in males, but usually young males, 2 to 4 years of age, you're probably not dealing with that in the black cat. Signs are similar. The symptoms are the same or similar, but a blocked cat in the scenario where you have an 18-year-old feline with multiple other issues is much lower on your list than something like a urinary tract infection or bladder cancer, bladder stones, crystals, etc. Things that develop over time, or if they have comorbidities that predispose them to these diseases, they're not blocked. They actually have urinary tract disease, but it's not an emergency. Versus the blocked cat, the orange cat there, that's an emergency all the time, urinary obstruction. So it's important that when you hear this over the phone to try and differentiate, well, what's the signalement of this cat? Now, this is not to say that an 18-year-old male cat cannot become blocked. Any cat can become blocked. It's an age It's an age-independent disease, but the majority of animals, of cats, are 2 to 4 years of age. They're younger, and they're the ones who are most commonly afflicted. Here's another concern that you have. The owner might say, my cat's constipated. He's trying to go to the bathroom. Nothing's coming out. Nothing's coming out. Well, most of us can agree constipation on its own is not a medical emergency. It just isn't. Yes, the patient's uncomfortable. Yes, they need to be seen and assessed and treated and everything else, but it's not a medical emergency, especially if they're still eating, drinking in the absence of other symptoms or clinical signs. It's not an emergency. However, is that pet owner confusing constipation, tenesmus, difficulty pooping with difficulty urinating? If you don't ask the question, well, have you seen him urinate? They'll pause, they'll think about it and say, well, actually, no, he hasn't peed. Is there a chance he could have peed anywhere else in the house and you guys aren't catching it? No, we live in a small apartment. There's no way. Is he indoor, outdoor? Kennedy's going outside. No, he's not. He's not. Do you have other cats at home? Maybe they share a litter box and you don't know who's peed where. Nope, he's the only cat. He hates other cats. One litter box and there's no urine in there. Whoa, okay, well then it may be that your cat either has 2 issues, constipation and a urinary obstruction, or more likely, he just got one and it's urinary obstruction. And now you've changed course, going from a non-emergency with constipation to an overt emergency with urinary obstruction. So again, similar to trauma, the lung disease and cardiac disease, the point here is to dive into the details to try and figure out, okay, I know urinary obstruction is an emergency, but is this really that? You won't know for certain because you can't, because if you're doing this over the phone and you're not that medically trained, you can't lay hands on the patient. You don't have a doctor assessing. You don't have pictures or videos. You just have a client. So if you're trying to figure out like where this goes, hopefully you now have some general guidelines you can use for urinary disease. If anybody wants to guess, gastrointestinal disease on this slide. So you've got vomiting and diarrhea and not eating. The old golden retriever there is less likely, especially if they have no history of ingesting foreign bodies, much less likely to have a foreign body obstruction than the cute puppy on the right who eats everything in sight, right? And the owner is like, I'm pretty sure my underwear is missing. And now this dog is vomiting and having diarrhea and not eating. 2 similar scenarios. Foreign bodies are very common. Golden retrievers especially, very common culprits of foreign body obstruction in the gastrointestinal tract. But when you dive into the details, that older dog that never gets into anything, they've owned him his entire life. He's not the kind of dog that does that. I swear, nothing's missing, nothing's chewed up, and acute onset vomiting, diarrhea. Well, there's a ton of differentials for that. But the point is it really an emergency? If it just happened that day, no other clinical signs, and they're pretty sure their vet will see them tomorrow, it's probably not. And they get Band-Aid this till the vet's open. Versus the puppy dog there, who's now not eating, lethargic, chews on everything, it's more likely to be something that ought to be seen today. Now, are there other differential diagnoses for a young golden retriever who has these generic signs? Of course. Everything from parvo to gastroenteritis, anything's possible. But more likely, and because it's so common and a surgical emergency, we're thinking, okay, worst case scenario, what could this be? Well, foreign body is really high up on this list. Now, I don't want to make it seem again that this is a differentiating factor, because that old golden can have a GDV, gastric dilatation and volvulus. There can be bloat involved, right? That's why when I say these things, I say in the absence of other clinical signs. If they're telling you that this golden retriever, especially the older one, because we see it usually in middle-aged to older dogs, not usually in puppies. If they're saying this older golden retriever has not just vomiting and diarrhea, not eating and lethargy, but abdominal distension, drooling, and the retching is happening every 30 minutes, every hour, very frequently, and it's non-productive retching, and it happened all of a sudden, right? There's no chronicity to it. Well, you have to change gears now. It may not be a foreign body necessarily because there's no history of that for this dog, but a GDV now goes higher on your list. So I don't want to make it sound like every single older dog that calls you with vomiting and diarrhea is not an emergency, but the point here is to dive into the details with it as best you possibly can to at least give the client some sort of direction of where to go. Neuro scares everybody. It's this nebulous thing in the vet field, and when you're trying to triage something, I've had folks, for example, in that picture in the bottom right, you can see in that dog's oral cavity, there's a rawhide stuck in between the arcades, the dental arcades there, the roof of the mouth. Well, we had a client that called up saying, my dog's having a seizure, and he's describing this dog as having the classic signs: drooling, convulsing, peeing and pooping there, not acting like himself. And when you hear this gentleman, you think, boy, this dog's undergoing a seizure. But yet when you watch him on video, the dog's actually actively pawing at his mouth, and he's pawing with such voraciousness, it looks like convulsions. And the dog is so irritated by it that he's peeing and pooping, and he's drooling like crazy because his mouth hurts. And so this is a big deal. And this is why I emphasize gold standard telehealth being synchronous, so real time, but also on video, is because you can see those things instead of going based on what the owner is describing. If I heard this owner over the phone, I would have thought classic seizure. I would refer them in for a seizure. They would have saw the dog and said, what? This is not a seizure. He's got something stuck in his mouth, which is fine. It needs to be seen anyway. In this case, this owner actually pulled the rawhide out. Problem solved. Dog cured, right? But just to give you an example of a apparently neurologic manifestation, but it really isn't. This is just the owner's interpretation. Then you have contrast the dog there in opisthotonus, that's laterally recumbent, actively seizing. Is every seizure an emergency? No, they're not. In general, at least my guidelines are, if a seizure lasts 4 minutes or more, or if you have 4 or more episodes in 24 hours, that's an emergency. You don't want a seizure to go on too long, and you don't want to have too many in a 24-hour period. Because the idea there, if it's going on too long, or it's happening very frequently, is you're risking brain damage. There's also a nidus forming in the brain that's now becoming the stimulus for chemical stimulation, and then that propagates itself, becomes a vicious cycle. In those cases, you want to stop the seizure, right? So that nidus doesn't happen. Well, not every seizuring dog is an emergency. And despite what the cause is, it may be a brain tumors or it could be liver disease, toxicity, but usually if it's under those guidelines, they're not emergencies. However, that's where the details come into play, right? If you've got a young dog with a sudden onset of seizures and he gets into stuff, let's say, for example, he's chewing on electrical cords, right? Or you live in an area where rat poison is a concern, and there are some that cause cerebral edema, right? Those are emergencies. You have to dive into what the risk factors are. So in general, when you think about seizures, and I have a YouTube video on my YouTube channel for anybody who's interested in watching, you talk about 3 different broad categories for seizures, and pet owners understand this once you describe it. First category, something in the brain. Examples are strokes, brain tumors. Second category, something internal, so liver, kidney toxicity. Third category, if you rule out the first 2, epilepsy, which is a chemical imbalance. Those are it. Those are 3 categories. Now, the question might be, well, how am I going to decipher that on video or even the phone? How am I going to know? In general, with those 3 categories, the ones that have something in the brain, usually older animals. Younger animals tend not to get brain tumors and strokes. They can, of course, but in general, the older dogs are the ones more likely to get that. If you have the second category, liver, kidney disease, etc., they usually have other clinical signs. They're also vomiting, have weight loss. There's other things wrong with them. They're sick for other reasons. And by the way, they have seizures. And the third category, epilepsy, we tend to see in the younger animals, right? 2, 3, 4 years of age. You can have late onset epilepsy. Late onset meaning it happens later in life. But usually most epileptics are younger animals. So just by age alone, you can figure out which category you're in. And then so if you're younger, you're more likely epilepsy. If you're older, more likely brain tumor or stroke. And then if you are neurologic seizuring plus other clinical signs, is there something going on internally? The point here, again, is not to necessarily make you all doctors to be able to triage this stuff. I want you to understand how we can grasp these things so the details matter. And then finally, that picture there of the dog, the golden retriever that has the head tilt, old dog vestibular is very common and can be described as a seizure as well by pet owners. But if you see them on video, they've got nystagmus, they have a head tilt, they have a vestibular ataxia to them. Well, old dog vestibular disease is not an emergency. Ear infections can cause the same thing, right? Those aren't emergencies. And so these are a great way to avoid having this dog wait in the waiting room in the emergency hospital for hours, and also going to spend a lot of money to figure out, oh, your dog just needs time to get better because of old dog vestibular. But they're describing it as a seizure, and ask the questions, what's he doing now? What's he look like? Does he have the typical seizuring of whole body convulsions, urinating and defecating and not conscious during the episode? and then he wakes up and he's like kind of weird for an hour or two, that's a seizure. Vestibular ataxia has none of those things. They're stumbling, they're dizzy, they're circling, their eyes are moving back and forth. So you want to dive into those details. The reason for the picture, that husky looking dog with the anisocoria, 2 different pupil sizes, is just to show you that some pet owners will catch a dog after a seizure, and they may not have seen the actual seizure itself. They notice the eyes are weird. And so you want to start asking about, well, does he have a history of seizures? Could he have had one? You guys had video footage when we weren't home. You have recording of what could have happened. If you happen to see pee and poop at home, which this dog never does, because maybe that's where he had a seizure, you know? So it's one differential for things like that. Again, it may not be an emergency. Those are my guidelines for whether or not a seizure is an emergency, but just to give you some overview. Now, next category for life-threatening issues, we went through the trauma, went through different body systems. Now we're talking about environmental. Everything from heat stroke, so for example, that bulldog down the bottom who's panting like crazy on that pavement, all the way to foreign bodies, porcupine quill attacks. So these are very common, right? And most things that we see, at least on VetTriage, are not true medical emergencies. The marijuana, the garlic, the onions, the raisins, the grapes, the chocolate, typically not. Depends on the dose, depends on the type, depends on what the dog's clinical signs are, how long was the exposure, or how long ago, rather, was the exposure. Could it be other things? Like, are you sure he got into pot, or are you guessing, or something like that? So you want to dive into those things. We frequently will access pet poison helpline on VetTriage for those cases that go above our knowledge base, where it's a really weird toxicity. You want to have or it's like a human drug, or the owner just wants just a second opinion. I calculated the grape dosage and it seems to be way below toxic levels, but they're like, doc, money's not an issue for us. We're willing to spend the extra to talk to a toxicologist. Great, let's refer you to pet poison helpline, and then you can get the toxicologist to back me up or not. If they think it's an emergency, we'll call you in. If it's not, great news, and then you can follow my palliative advice at home. Porcupine quills, super common, not always an emergency. I've had owners that were able to, on video, pull quills from their dog's face at home. But if you have a really bad one, for example, the quills are in the dog's nose, in the dog's mouth, there's no way a pet owner is going to remove them. And those usually require emergency dequilling, quill extraction that night. So if they have access to emergency care and the quills are bad enough, then let's go. If, however, it's only a few quills, and if you add that to the fact that they have to drive 3 hours to get to the emergency hospital and they can't afford $1,000 for exam, blood work, sedation, quill removal, then maybe it's a situation, if you're fortunate enough, that we can either remove the quills at home or try to sedate the dog enough so that he stops pawing at his face to not break the quills or make them migrate in long enough so that their vet can open the next day or the next week to be seen. Again, these are situations where, geographically speaking, the clients will have a lot of access to care, but the point is not every quill attack is an emergency. And then finally, you have the dog there who's chewing kind of electric cord. Electrocution, very common. It can be very tricky. And you want to have the signalment of a young puppy who's exploring, especially if you ask the owners, is there any chance you could have chewed any cords? And they'll think, I don't know. And they'll start searching the house, and sometimes they find a chewed cord. And the reason why these are tricky is because electrocution can be anything from no clinical signs to a burned mouth or a burned tongue, all the way to neurologic disease and non-cardiogenic pulmonary edema, so difficulty breathing because of fluid buildup in the lungs. And so it depends. Not every single electrocution, or let's say cord chewing, is an emergency. Not all of them are. But the ones that are showing like neurologic symptoms, for example, or pulmonary symptoms, respiratory symptoms, those are emergencies. You have to be seen right away. So you want to make sure to dive into these things and figure it out from there. So that's our life category. Again, broad overview, not meaning to intimidate you with all of this information, but just to give you the idea and appreciation for how much detail you're trying to investigate when triaging, especially if you don't have the medical knowledge, and especially if you don't have video or pictures in front of you and you're trying to figure out how to help this person. Eye disease, that's the site. So the LOL, we're on ocular now. The yellow box there with post-ictal phase. Post-ictal means after a seizure. And frequently dogs will seem disoriented and they'll actually be blind after a seizure. It's usually not permanent. It can last an hour or two. But an owner may notice when they come home, their dog is bumping into things and it just had a seizure. Well, if it just had a seizure, now it's bumping into things, and let's say as you're talking to them, the dog's vision is regaining, it's no longer an emergency. Whereas the dog on the top right with the bilateral dilated pupils that has retinal atrophy, that's an emergency. That ought to be seen. So acute blindness, depending on the scenario, is not always an emergency. It depends. On the left there, you have the golden retriever with bilateral cataracts. The owners will swear he was fine this morning and all of a sudden he's blind. Well, those cataracts were forming over months or years, probably secondary to diabetes mellitus. It's a very common duo. Not an emergency though. Yes, your dog is acutely blind, but this is happening over time. This is just the straw that broke the camel's back. Now all of a sudden he can't see. He was seeing fine hours ago because the cataracts just had to get a little bit bigger to get the blindness going. Not an emergency. Not an emergency. On the middle picture there, the close-up of the dog's eyes, a lens luxation. So you have the aphakic crest there, and a lens luxation depends. Some are emergencies, some aren't. You don't want the lens luxation to cause an increase in intraocular pressure and getting secondary glaucoma. So you have to ask for more questions about, well, is he having trouble seeing? I know his eye looks weird to you. Is he having difficulty seeing? Are his eyes red? Are they bloodshot? Is he scratching at them? Because if he's bothered by the eyes and they're painful, he probably ought to be seen. If he's not, if he's acting fine, the eye is not red, and it's not like swollen or bulging, maybe it's okay to wait till your vet's open. And then the bottom picture is a cat with, again, bilateral dilated pupils, some mydriasis. But here's the thing. Cats that have dilated pupils, could it be post-ictal like a seizure? Yeah, maybe, but seizures are not that common in cats. What's more common in cats are diseases like diabetes, hyperthyroidism, and cardiac disease. And those diseases predisposes cats to having a stroke in the brain. And a stroke in the brain can cause this. The same thing goes for those diseases, and hypertension. High blood pressure can cause this. So a cat with dilated pupils is usually an emergency if you dive into the details of the history. However, dilated pupils can happen because they're scared. Is there did you guys just adopt a new dog? Is there a scary dog barking outside that's freaking out your cat? Thunderstorms, right? You have a guest over that, and the cat just hates other people. Are those eyes dilated because he's just terrified, right? Usually cats in the situation that have actual hypertension or a stroke, they're also usually blind. Whereas the cat who's freaked out is not blind. They can still see. Their eyes are dilated because they're in like stress mode, fight or flight response, but they can still see. So these are things you have to quiz the owner about, because they're going to call you and say, my cat's eyes are dilated. Like, is that an emergency? And your question is, well, is he freaked out, or does he actually have pre-existing cardiac, renal, thyroid disease? Most of us that have worked in vet hospitals have seen cases like this. An obvious one is that pug in the center there with a proptost eye. Those are always considered emergencies. Now, you can get a bit more nuanced with them because they're not always emergencies, but the vast majority you're going to want to call in. Regardless of how mild or severe it is, you ought to call them in. You don't want to risk sight, especially for a problem like proptosis, that as long as it's not too severe, you can reverse it. You can treat them and they can save their vision. I mentioned I put the picture there of the eyelid laceration because eyelid lacerations, just like open fractures, are usually considered an emergency. However, they're only considered an emergency because you want someone to address them fairly quickly. You don't have to have emergency eyelid surgery in the middle of the night with a dog. It can be done the next day or early the next week. But if it goes too long and they don't get it tended to and heals abnormally, it can affect the ability for the eye to close normally, which can then lead to things like corneal ulceration. So it's not an emergency in that it's 3 a.m. and needs to be repaired right now, but you want to repair the next few days, right? Open fractures, the same thing. They usually say, oh, those are emergencies. Well, they're not surgical emergencies. You're not going to do a 3 a.m. Femur fracture fixation. That's not a thing. But the wound stuff, the stuff that risks bone infection, that's the part that you're worried about. And then, of course, on top of that, pain, obviously. But my point here is sometimes you hear things that are emergencies, but they don't technically mean that they have to be attended to immediately. And if they do have to be attended to immediately, it's not like you're attending to every aspect of that problem. You're focusing on the part that is the most like concerning or life-threatening or whatever. A dog there, the Chihuahua with the blue eye, that looks like a ulcer that's so deep that it's causing inflammation and infection in the eye. Now, you can also have dogs have cloudy eyes from cataracts, like we showed in the other slide, or they can have degeneration of the cornea, which is an age-related degeneration. That's a normal thing, and it can look cloudy. So you're trying to differentiate, and this is where pictures really come into play here, is this a melting ulcer that is an emergency, or else they're going to risk losing that eye if we don't get them treated tonight? Or is this an old dog that's developing degeneration? One of the clues that you can figure this out is, well, is this both eyes or not? If it's only the one eye, you're way more concerned about that being an emergency, like uveitis and corneal ulceration or perforation, versus if it's both eyes. Of course, you could have a dog with bilateral corneal ulcerations, but usually it's one eye. And so both eyes are kind of cloudy. Well, now you're thinking, okay, maybe this is age-related, especially if they're older. Might be cataracts because they have diabetes. So, but in general, most of us will say, well, if the blue eye or a red eye, you probably should go around emergency. But if you wanted to parse out the details, you could, and not every single one of these becomes an emergency. The center bottom picture is a foreign body penetrated into the eye. These are always emergencies. That eye looks pretty damn good otherwise, but you need to be removed. And so you want to go in that night before this turns into an infection and they have a corneal perforation, and then they lose intraocular pressure and all that. So those are emergencies. And the last category of our LOL is limb. These come in all different shapes and sizes. The dachshund there who's paralyzed in the hind legs, that's always an emergency. Always an emergency. They may say, oh, he's just having difficulty walking. Pet owners are not going to use the word paralyzed. They're not going to say that. He's just not walking right. He's dragging himself around. Well, I've had dogs that have cruciate tears that are described as being dragging themselves around. But a dachshund who's paralyzed, who's dragging themselves around, is a big deal, right? The center picture, that German Shepherd, he's got a fractured limb. Seems pretty good otherwise. It's actually weight bearing on it. So is that an emergency for tonight? Maybe not for this dog. Should he be seen? Of course. In the middle of the night? Maybe not. Maybe not. Maybe we can find ways to band-aid this until I don't mean band-aid like a bandage. I mean band-aid like, can we find out there's analgesics at home? Can we restrict his activity? Keep him separate from other pets? Make sure he's got food and water close by so he's not walking around. Things like that. The dog on the black and white picture there, the dog's got one leg that's flopped over like that. He's scuffing it, right? Well, you might look at that and say, oh, that's an emergency. It's an emergency. He must have a disc herniation like that dachshund, But usually a large breed dog, especially middle to older age large breed dog with only one leg affected, especially a hind leg, you're usually talking about a stroke to the spinal cord, which is not a medical emergency, and that actually gets better over time on its own, or with some medication and physical therapy, but that can be handled at their family veterinarian the next day or the next week. Fibrocartilaginous embolic myelopathy, FCEM, is the word for stroke in the spinal cord. And if I have a dog like this, the owner is freaking out. I'm trying to figure out, okay, do they mean paralysis? What are they talking about? It's one leg, and it's a large breed dog. Now, can a large breed dog with one neurologic leg be a disc herniation or some other surgical emergency? Of course they can. Of course, I've seen them before. But in general, we're talking in general here, if you're trying to sort of figure out the triaging, I'm not as concerned in that scenario as I am with the dachshund. And then the other point with limb, besides neurologic and orthopedic issues, that dog with the bruised leg there. If you have bleeding into the muscle planes, whether it be a tumor that ruptured or a dog bite wound or some kind of other trauma, gunshot or whatever, and you have a dog that's getting progressively more anemic and the blood is just filling up, you don't want to lose that leg if you can salvage it. You also don't make sure that dog doesn't become anemic to the point where it's life-threatening. So you may have an owner that says, well, my dog just has some bruising. Is it a big deal? And you're thinking, well, bruising is not a big deal. Everybody bruises, right? Well, in this scenario, it might actually be an emergency, and so you need to dive into more of the details for it. Finally, other species. I'm certainly not a specialist with these other animal types, but I can at least give you some trends. The saying used to be with birds that a healthy, good-looking bird is a sick bird, and a sick bird is a dead bird. That's how it speaks to the sensitivity of birds. They are so fragile. And so we try to have them avoid going to the emergency hospital if possible because of the stress of the drive. Maybe it's cold outside and they're in the hospital and there's all new people and smells and everything. And that's going to worsen their sympathetic nervous system. But you don't want a bird who needs to be seen stay at home either out of fear of stressing them out. So in general, any bird that's at the bottom of the cage puffed up, not eating, should be considered an emergency. If they're regurgitating, which birds never do, unless they're really, really sick, they have to be seen. So those are kind of two sort of blanket, they should just go into to emergency. If they don't have emergency care, a platform like VetTriage, the veterinarians will help band-aid the situation, give palliative care at home so they can see somebody. But in general, birds, you don't want to sit on them. Now, if you have a bird that's fine otherwise, but like limping on a leg or has like one wing drooping, but otherwise is fine, you can probably sit those out, But again, it depends on how much questioning. But in general, you don't want to sit on a bird that's like at the bottom of the cage, puffed up and not eating. Here's another common non-dog and cat species we see: reptiles, iguanas, bearded dragons. These dogs will present to us acutely emaciated, and this didn't happen overnight, right? And calcium deficiency in these species, very, very common. Is it a true medical emergency to be seen at the hospital? Yes and no. I mean, it's a chronic issue that requires discussion about husbandry and long-term management, but also this thing might be dying, especially when they get that black color to their skin. And they might have pathologic fractures, so they have broken bones because of it. So it becomes a quality of life issue too. And is this to the point where it's like of no return? So they are emergencies from the standpoint of like having a frank conversation about the owner about proper husbandry. Whether or not it's too late for this animal, I don't know. But these are really sad cases because it seems to have happened overnight. But these are certainly chronic issues with these guys. And then small mammals, ferrets with hind limb weakness or paralysis, very common, and can be for a variety of reasons. The reasons differ based on age. A lot of times, older ones get different problems than younger ones. Whether they're all truly emergencies depends on the details. It's hard for me to give you an exact blanket statement for that. But if there's any doubt with a ferret that has hind limb paralysis, they ought to be seen. Same thing with that rabbit there. Rabbits with hind limb paralysis almost always have to be seen. Probably going to be euthanasia if they have a fractured back from an accident in their cage or jumping out of someone's arms or falling off someone's arms or whatever. It's unfortunately a very sad outcome. But for pain management purposes, most emergency hospitals will at least see these guys. They can shoot a radiograph to diagnose a fracture or subluxation, and then euthanize if that's the case. And then the other ones at the bottom there, you have a rabbit with looks kind of dumpy. His head is down. He hasn't pooped in a day or two. He's not really eating now. Gastrointestinal ileus, so GI stasis in rabbits, very common. Tend to be emergencies for the most part. Some can be managed at home depending on the duration of these clinical signs. But it's tough with them. The rabbit there with the head tilt, I tend to not see great outcomes with these. To me, these are going to be emergencies, but not always. If they're eating, drinking, and doing fine otherwise, maybe it's just an ear infection and they'll be okay. But there are other infectious diseases they get that are a bit more life-threatening, and so I typically will suggest they go in for emergency if they have access to that. And then the pocket pet there in the center is just a reminder that pet owners will frequently, surprisingly, describe a guinea pig or a hamster that's laterally recumbent and dyspneic, literally having trouble breathing. And their only complaint is, well, he's a bit lethargic and not eating today. What do you think is going on? And then on video, we're seeing a patient that's literally dying in front of you, but the pet owner doesn't recognize that. These are pocket pets. Their interactions probably minimal. They don't do a lot. They're not like a dog that's always jumping on you and stuff. So these can be a bit sad because by the time you get to them, it's too late. But the point is, if the client calls up with a pocket pet and just says, he's lethargic and weak, not really eating, but he was fine like 3 hours ago, don't always assume that's fine. Wait till tomorrow. You may want to dive in more about the position of the pet. So all that information, hopefully you can glean some insight from it. I'm not trying to make everybody here a doctor, nor suggest that you should be triaging over the phone, especially with cases that require diving in. I want you to have an appreciation for how much detail it goes into trying to figure out fairly common overt emergencies. And the point is, LOL, right? Life, ocular, and limb. You're trying to save those three things. Is this condition going to kill this patient? Are they risking losing permanent vision? Can they risk losing a limb? Those are three broad categories that you want to think about when you're triaging in general. So there you are, you're a receptionist, you're on the phone's ringing off the hook. You're the only one there. 2 people called out sick. You've got a waiting room full of pet owners who are just staring at you, waiting to be seen. It's very, very stressful. And so let's talk about optimizing the workflow. Again, not to necessarily pitch VetTriage to you, but because we are the gold standard, video and doctors, and I want you to be able to understand how to manage your day. This is what's currently happening in most facilities. The client will call the office and they have a question or a concern, and they want either to be seen that day or some sort of guidance that moment. They don't want to wait till tomorrow when the doctor is back, or next week when the hospital is going to reopen, because right now it's 4:30 and it's a Friday and you're trying to close by 5. They want to know right now what should I do. So they're calling you, and so you answer the phone. You're not medically trained, but you want to help. And you're now, because of this phone call, and the owner is going through the story of this pet, they're concerned, you want to help them. Your other duties are on hold. And while you're trying to figure out the level of urgency here, but everybody else is staring at you and the phones are ringing, and so-and-so needs to be discharged and billed out and pick up their food and all this stuff. Well, now you have 2 options in this scenario. And keep in mind, everything we just talked about, the LOL, everything we talked about just now, right? All that stuff is in the back of your mind. You're like, okay, is this a LOL situation? Like, should I be worried about it? So then your next 2 options. Do you have open appointments at your facility for that day? And if you do, is your hospital operations such that you can fill in a slot last minute or have a walk-in appointment, right? If so, then you're able to fill in that appointment. You don't know if it's an emergency or not, but we're still open and we have some slots open. Come on in. You know, can you get here in 30 minutes? You know, I'll be there in 15. Great. Drive safe. We'll see you soon. Or alternatively, no open appointments. And then this case either goes to the emergency hospital, maybe didn't have to go. And so now that client's spent time and money there, which could have been revenue and loyalty back to your facility as an appointment for a non-emergency. Or the client does the opposite thing, doesn't go to ER, and it should have gone to ER. And now the pet is worse or dies overnight, and now they're upset and feeling guilty because they didn't go to the emergency hospital. Those are 2 options. You know, go or don't go. But we can't see you. We don't have any more appointments, and it's Friday. We're not open again until Monday, and Monday's pretty booked. And after a weekend, it gets pretty busy, right? So the point of this is, and this is unfortunately the reality that I'm sure a lot of you are familiar with. This is not a sustainable model. It is a bit uncomfortable and somewhat risky. There's legal and ethical concerns with trying to triage over the phone, but at least now, after this talk, hopefully you have some general guidelines of how to think about it. The client may still leave that phone call unsure because, you know, you're not trying to steer them wrong. You don't want to mislead them. You also don't want to speak inappropriately or out of turn. So they're like, I don't know. I still don't know if it's an emergency or not. Those phone calls don't generate revenue for the hospital. They only actually lose revenue because now you, a valuable person, valuable team member, is stuck on the phone and can't perform your other duties. So your other duties become on hold, and then this creates a downstream effect of delays with other aspects of your operations. Now, so-and-so got discharged later than they wanted to. Someone's still waiting to get billed out. This person was hoping to pick up their food and get home, you know, in time to make dinner, whatever. All these pressures are commonplace, and so this has downstream effects. As opposed to if you partnered with VetTriage or any other platform, hopefully VetTriage, of course, you have now a way you can offload these cases to somebody. So in this scenario, the client calls, they have a concern, they want help the same day. You don't have any appointments open, no walk-in slots. Your doctors are like, no, I got to get out of here at 5, guys. I have my kid's soccer game. I got to go. So instead, you tell the client, look, our doctors are unavailable. I can't give you advice. It sounds like, because it's a neurologic dog, it's having seizures, and you've already had, you said it lasts 5 minutes. It sounds like it's an emergency, but I'm not medically trained. So here's what I would think you should do. Let's get you with VetTriage. It's live video. It takes you a few minutes, $50, and you'll talk to a veterinarian, and they'll try and decipher this for you. Because you're also expressing to me that the emergency hospital is an hour away and you don't like driving at night, and maybe finances are a problem too. Maybe you should talk to a veterinarian and see like what you should do here. And so we will then determine, is it an emergency? If it is, we'll follow your hospital protocols based on the partnership for which emergency hospital to send the case to. And we'll call them in ourselves to refer them to make sure the client is going to be seen when they get there. Or most cases, not emergent, and we'll give them advice and monitoring parameters with the idea they're going to make an appointment with you at your convenience when you guys are open again. And so that's the way triage works. Again, with the phone triage system, this is still the same idea. Is this an emergency or not, or can this wait? It adds another dimension when you've got a veterinarian on live video doing it. So in this workflow, maintain client loyalty, maintain revenue. If you think about it, people will sacrifice their vaccines for their pet because of finances they just spent on the emergency hospital last week for a broken nail. And you don't want that to happen. You want the client to avoid the unnecessary emergency and expense with that, and see you for an appointment for vaccines and preventive care and follow-up. There's also no legal or ethical concerns with this model because the veterinarians will assume all concerns there. They assume all liability, rather. The receptionist, other duties can proceed uninterrupted. You can move on with your day, do what you do best. It expands access to care for hospital clients. So for those folks who can't drive to the ER, it's bad weather outside, whatever, they want to talk quality of life maybe, so this is a good way of accessing care, increase access and spectrum of care. This confirms necessary emergency visits. It improves the culture in the workforce. It improves recruitment efforts. Nobody who joins a reception team has a goal of giving medical advice, right? They want to do receptionist things, and so it's tough if folks are being drained emotionally because they have to try and triage things. It can be a bit awkward and uncomfortable. Hopefully with this talk, you're a bit more comfortable and you can exercise some of the basic concepts we learned here, but it helps with culture and recruitment efforts and turnover when you can turf cases to somebody else who doesn't mind having cases turfed to them. So this provides a tailored solution for any geographic or other unique challenges that your hospital faces. We can accommodate for that. So this is just a process. I'm not going to go into this in a lot of detail. The bulk of this talk was meant to be educational, give you exposure for different emergencies. But essentially, if your hospital wants to partner with us, reach out to me. We'll create a landing page. We'll create flyers and your protocols. I wanted to just show you here some of the aspects. We talked about the flyers. This is an example of a hospital in Hawaii that uses us. You scroll down to the bottom. You go to the website after hours, and you see in the bottom there, after hours services. You scroll down. There's VetTriage, a blurb. Push the button, connect with a doctor, and then they can talk to us. When they push that button, they get sent them to a landing page. So here's another hospital. This is their hospital logo on there for Weiser Veterinary Clinic, and there's another blurb on there. Connect in 3 easy steps. The client will then click on that part and then create the account. Here's a mixed animal hospital that we partnered with, and so when the client clicks on the landing page and gets to this page, they have to just fill in the information. We make this process really simple. So for example, if you're phone triaging, you're trying to figure out what species, what age, what gender, any medical history. We have none of that information here because I want the pet owner to get on as quickly as possible. I don't want them to spend time writing the dog's breed, the cat's weight. How old is he? I don't know. Then they look at the disclaimer, they approve it, they have to hit agree. The disclaimer talks about veterinary client-patient relationship and the pros and cons of virtual care. And then when they're ready, they pay. You can see their step 2 lights up. This is an equine case. That's why there's a horse there. And so step 2 pops up and says, okay, buy your session. They're going to go ahead and buy it. Equine is $75. Non-equine is $50. And then when their payment goes through, they hit the 3rd button to request session, and then they're going to be on with the doctor. And so this process takes less than a minute to get done, and they can talk to a veterinarian immediately. So in closing, here's my contact information. If you have any questions at all, I want to thank everybody for watching and listening to this. I hope it wasn't too overwhelming. I do welcome any feedback because this is a talk that's very popular. And so if there's things you want to see, I'm happy to improve it. That's a QR code to the partnership page for VetTriage. Thank you everybody for attending. And if you have any questions or anything like that, I'm more than happy to entertain anything you have now or any feedback that you have for me. I'll be happy to talk about it.
If you guys want to use the Q&A in the box to the left to ask some questions to Dr. Ireifej, he can go ahead and field those for you now.
I can go back to any slides that folks want to if they want to look at something. And again, I just want to keep in mind too, there are plenty of other diseases, traumatic situations we didn't go over, toxicities, things like that, right? It's impossible to go over the entire list, but I want to focus on LOL so that you have a basic idea of urgency and what our priorities really are. You know, that's the main concern when you're trying to triage. How urgent is it?
Okay, so we'll go ahead and move on then. So thank you guys for coming tonight. We have some upcoming live webinars later in April. We have case management strategies for the new critical care DVM with Sean P. Dent. And then in May 2024, we have the complete guide to ECG interpretation in veterinary medicine. And in June 2024, we have bandaging 103, wound management, wound dressings, and bandaging considerations. You guys will be redirected to a survey to fill out after exiting the webinar tonight. Please go ahead and fill that out in entirety for us. We really value your feedback. And then you guys will be able to navigate to the Your CE portal on the VetMedology website. And this webinar will be available to you by tomorrow to complete the required quiz to earn your free certificate of completion. So if no one has any questions, we will go ahead and sign off for tonight.
Thank you.
All right. Thank you so much, Shadi. That was wonderful.
Yeah, my pleasure. Thank you so much. If you need anything else from me, I'm happy to help. Thank you for listening and watching.
Absolutely. Thank you. Thank you, everyone, for attending.